13 products that kill your liver and 7 products that benefit your liver. Today, we'll dive into the fascinating world of our liver, a silent hero responsible for keeping our health in check. Did you know that certain foods and habits can be villains in the story of your liver's health? Let's reveal which products are secretly harming this vital organ and how you can combat this with smart dietary choices. Can you guess which common food is one of the biggest enemies of your liver? Stay with us to find out. Moreover, which superfoods can transform the health of your liver, making it stronger and more resilient? And lastly, did you know there's a popular drink you consume daily that might be protecting your liver without you knowing? Don't miss these surprising answers and essential tips for keeping your liver healthy. Let's get started. Importance and functions of the liver. The liver, being the largest internal organ in the body, plays vital roles that support nearly every aspect of our health. Located on the right side of the abdominal cavity, under the diaphragm, this multifunctional organ is crucial in the detoxification process, metabolism, and in the synthesis of important proteins for blood clotting. It filters and processes blood coming from the digestive tract before passing it to the rest of the body, removing toxins, metabolizing drugs, and breaking down old blood cells. The liver also stores vitamins and minerals, regulates glucose levels, produces bile for the digestion of fats, and assists in hormonal regulation. Its ability to regenerate damaged tissue is unique, highlighting its indispensable importance in maintaining health and well-being. Products that kill your liver. 1. Red meat. Excessive consumption of red meat, rich in saturated fats and cholesterol, can overload the liver, making it difficult to metabolize fats and proteins. This can increase the risk of developing fatty liver disease and other metabolic disorders. Red meat also contains compounds that can be converted into toxic substances during digestion, requiring more effort from the liver for detoxification. Moderating red meat consumption and prioritizing lean protein sources such as poultry, fish, and legumes can help maintain liver health, ensuring it functions effectively without being overloaded. 2. Fried foods. Fried foods, prepared in oil at high temperatures, generate a series of harmful compounds, including acrylamide and free radicals, which can cause liver damage. These foods increase the load on the organ due to the high levels of trans and saturated fats, requiring more effort to metabolize and process fats. Frequent intake of fried foods is associated with an increased risk of non-alcoholic fatty liver disease, NAFLD, a condition that can progress to chronic liver inflammation and cirrhosis. Limiting fried food consumption and opting for healthier cooking methods, such as baking or steaming, can help reduce the risk of liver diseases. 3. Canned foods. Canned foods may contain high levels of sodium and preservatives that overload the liver and contribute to the development of liver fibrosis. Fibrosis is the first stage of liver tissue scarring, which can progress to cirrhosis if the intake of high-sodium foods is not controlled. Opting for fresh or minimally processed foods and checking labels for low-sodium options can help reduce sodium intake and protect liver health. 4. Canned fruits. Canned fruits, often packed in sugar syrup or corn syrup, contain high doses of fructose, which, in excess, can overload the liver. Fructose metabolism is unique to the liver, and an overload can lead to the buildup of liver fat, contributing to fatty liver disease. Opting for fresh or frozen fruits, which do not contain the added sugars present in canned versions, is a healthier choice to maintain optimized liver function and avoid liver damage. 5. Spicy spices. While spices can enrich foods with flavor and offer health benefits, excessive consumption of spicy spices can be harmful to the liver. They stimulate the production of excess bile, which can overload the liver and bile ducts, leading to the formation of gallstones and the development of fatty liver disease. Spicy spices should be used in moderation, especially by individuals with pre-existing liver conditions or sensitivity to spicy foods. Incorporating seasonings in a balanced way in the diet can help avoid potential liver damage, keeping it healthy and functional. 6. Salty products. High intake of salt and salty products contributes to excess sodium in the body, exceeding the recommended daily intake of 2,000 milligrams. This excess can cause kidney complications and fluid imbalances, directly affecting liver function. High amounts of sodium hinder blood filtration and overload the liver, potentially impairing its ability to process substances and detoxify the body. In the long term, this overload can lead to more severe liver conditions, highlighting the importance of moderating consumption of highly salted products to preserve liver health. 7. Fatty foods. Foods high in fats, especially trans and saturated fats, can lead to an increase in inflammatory processes in liver tissue, contributing to the development of liver diseases such as cirrhosis and liver cancer. These foods quickly raise levels of LDL cholesterol, bad cholesterol, placing additional pressure on the liver to filter and process these substances. Moderating the intake of fatty foods, replacing them with healthy fats found in fish, nuts, and olive oil, can help maintain liver health and prevent liver diseases. 8. Sodas. Sodas can be harmful to the liver due to their high fructose content, usually found in the form of high fructose corn syrup, a common sweetener in these products. The liver is the primary organ responsible for metabolizing fructose. When we consume fructose in excess, the liver is forced to convert a large part of that fructose into fat. This process can lead to the accumulation of fat in the liver, a condition known as non-alcoholic fatty liver disease, NAFLD. Additionally, excessive fructose consumption can increase insulin resistance, a precursor to type 2 diabetes, and promote an inflammatory state in the body, contributing to the development of liver diseases. Therefore, frequent consumption of sodas can overload the liver, increasing the risk of liver diseases and other health problems. 9. Sweets. Excessive consumption of sweets, rich in refined sugars and artificial sweeteners, can lead to an increased load on the liver. The digestion of large amounts of refined sugar requires the liver to convert excess glucose into fat, which can contribute to the accumulation of liver fat and non-alcoholic fatty liver disease. Additionally, many sweets contain additives and artificial colorings that can be toxic to the liver. Choosing healthier alternatives, such as sweets made with natural ingredients and low in added sugars, can help reduce the negative impact on the liver. 10. Anabolic steroids. The use of anabolic steroids, commonly associated with the pursuit of increased muscle mass and athletic performance, can have significant harmful effects on the liver. These substances, which are synthetic versions of testosterone, can lead to the development of liver conditions such as pileosis hepatitis, characterized by the formation of blood-filled cysts in the liver and liver tumors, both benign and malignant. Furthermore, prolonged use of anabolic steroids can cause the elevation of liver enzymes indicative of liver stress or damage. These adverse effects are particularly concerning due to the popularity of these substances in certain physical training environments and among athletes, highlighting the need for awareness of the liver risks associated with their use. 11. Tobacco products. The consumption of tobacco products is widely known for its harmful effects on health, including heart disease and lung cancer. However, its impact on the liver is also significant. Smoking tobacco can increase the risk of developing chronic liver diseases and liver cancer. Nicotine and other chemicals present in tobacco can cause inflammation and damage to liver tissue, exacerbating the risk of fibrosis and liver cirrhosis. Additionally, smoking can negatively affect the efficacy of treatments for liver conditions, slowing the recovery process. The combination of smoking with other risk factors, such as excessive alcohol consumption and obesity, can further increase the risk of liver complications, highlighting the importance of avoiding the use of tobacco products for the preservation of liver health. 12. Alcohol consumption. Alcohol is metabolized by the liver, and its excessive consumption can cause severe damage to this organ. Alcohol abuse can lead to alcoholic fatty liver disease, alcoholic hepatitis, fibrosis, and eventually cirrhosis. The liver has limited capacity to process alcohol, and excessive consumption can overload it, preventing it from performing its normal functions and causing fat accumulation, inflammation, and cell death. Moderation in alcohol consumption, or total abstinence, is crucial to maintain liver health and prevent liver diseases. 13. Over-the-counter medications. Over-the-counter medications, such as acetaminophen, paracetamol, are widely used for pain relief and fever. Although safe when consumed in recommended doses, Excessive or prolonged use of these medications can lead to serious liver damage. Acetaminophen, in particular, is a common cause of acute liver injury and fulminant liver failure, especially when consumed in doses exceeding the recommended daily limits or in combination with alcohol. The liver is responsible for metabolizing acetaminophen, and high doses can produce toxic metabolites that can damage liver cells. This toxicity is exacerbated in individuals with pre-existing liver diseases or chronic alcohol consumption. Therefore, it is crucial to follow dosage guidelines and consult a doctor before using over-the-counter medications, especially in cases of prolonged use or underlying health conditions. Now let's talk about products beneficial for the liver. 1. Beets. Consuming beets can bring numerous benefits to liver health. This vibrantly colored vegetable is rich in natural antioxidants and compounds that stimulate the liver's detoxification enzymes, aiding in the effective elimination of toxins. Beets are also a rich source of nitrates and soluble fiber, which have been associated with improved blood flow and reduced inflammation, thus supporting overall liver health and improving its ability to regenerate and detoxify. 2. Pumpkin. Pumpkin, with its high content of vitamins and the rare vitamin T, is especially beneficial for the liver when consumed along with fatty foods. It facilitates the digestion of fats and helps to restore the hepatic cellular metabolism and damaged liver structure. Incorporating pumpkin into the diet can help support healthy liver function, protecting liver cells, and assisting in the metabolism of fats. 3. Coffee. Studies indicate that coffee possesses properties that can protect against liver diseases, including reducing the risk of liver cirrhosis. Moderate consumption of coffee, especially pure and without excessive sweeteners or cream, can decrease the amount of fat in the liver and increase the levels of protective antioxidants, contributing to the prevention of liver scarring. Coffee is a beneficial addition to the diet for those looking to maintain or improve liver health. 4. Garlic. Garlic is recognized for its powerful antioxidant, antibiotic, and antifungal properties, thanks to the compounds of allicin and sulfur. Regularly consuming garlic can activate enzymes in the liver that help in the elimination of toxins, significantly contributing to detoxification and overall liver health. However, it is important to consume it in moderation, especially for those with gastrointestinal conditions, to avoid adverse effects. Including garlic in the diet can be an effective strategy to support liver function and promote liver health. 5. Broccoli. Including broccoli in the diet is beneficial for liver health, as this cruciferous vegetable is rich in compounds that promote the production of liver detoxification enzymes. Broccoli contains important nutrients that help protect the organ against damage, reducing the risk of developing liver diseases such as non-alcoholic fatty liver disease. Additionally, its high fiber content supports digestive health, which indirectly benefits liver function by reducing the toxin load. 6. Avocado. Avocado is rich in antioxidants, such as glutathione, which are crucial for filtering harmful substances and protecting liver cells. Furthermore, the vitamins C and E present in avocado help neutralize free radicals and have anti-inflammatory properties that benefit liver health. Regular inclusion of avocado in the diet is recommended to activate the production of essential antioxidants, promoting liver health and well-being. 7. Artichoke. Artichoke is a powerful ally of the liver, thanks to its rich content in cynarin, a bioactive compound that stimulates bile production. Bile is essential for the digestion and absorption of fats, as well as facilitating the elimination of toxins and waste from the body. Regularly consuming artichoke can help improve liver function, promote the regeneration of liver cells, and protect against liver diseases by optimizing the detoxification process. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.